and how I wanted to use what I had learned medically. So I went from being this aspiring cardiovascular surgeon to a family practitioner in Pottstown, Pennsylvania, a semi-rural factory town in the early 1970s. I had long hair and a big fat beard, right? And some desire to use my medical skills to take care of workers and farmers in that setting. I wanted to somehow become a part of the political and social life of that community. And that's where I first saw Dr. Selikoff's picture in 1974. And Phil was just talking about the work that Sinai was beginning to do about vinyl chloride monomer. Because in this town, there was a PVC polymerization plant where the monomer was hooked up into the PVC plastic. And by the time Selikoff and Dr. Ruth Lillis, whom some of you I'm sure remember well, had come to this town, right? I already had a practice that was very large because I didn't charge very much money, and I wasn't able to attend this meeting that Dr. Selikoff had, really to talk with the workers in that union local, it was a rubber workers local, about how to protect themselves from exposure to vinyl chloride, and and he talked to the town officials about what's to think about all the exposure that the town was having because there were no traps on emissions from that plant. Now, the relationship between vinyl chloride monomer and this angiosarcoma of the liver had just been discovered within the past year or two by John Creech in Lexington, Kentucky. He found 4 cases of people who worked in a PVC polymerization plant. And this is a rare cancer of the liver. It's not even the most common type of liver cancer. So it was quite striking that these 4 workers had developed this. He published this paper, and a number of people focused a lot on this because there was a lot of PVC being made in the United States. So Dr. Selikoff and the Mount Sinai entourage came to Pottstown, Pennsylvania. And as I said, I had lots of patients who were in my practice who worked in that polymerization plant, and they'd work in these reaction vessels without respiratory protection. And as you might know, vinyl chloride monomer is an anesthetic gas. They actually used to use it for surgical anesthesia. It became too dangerous to use. It's explosive, I think, and it wasn't easy to manage anesthesia. But my patients were getting regularly anesthetized, right? And there was no mention of any protections. They were working essentially unprotected in these closed spaces. When Dr. Selikoff came and made his presentation to those workers in that plant, I couldn't go, but they listened real hard. And when they came out of that meeting armed with these facts and these concerns, they immediately made demands on company management. They wanted air-supplied respirators if they were going to go back into these reaction vessels, and they made demands on their union. Well, the company said, we're not doing this. We don't believe any of this, and we don't think it's necessary, and it's going to slow down production, and you're not going to get them. And the union, unfortunately, was slow to respond. So this group, an independent group of workers in the plant, essentially called a strike for 3 days. Right? And I supported the strike because by that time I'd read what Selikoff was talking about. I understood what some of the issues were. This wasn't just a question of my patients getting knocked out regularly, but they were being placed at risk for a fatal cancer. And so I supported this strike, and lo and behold, after 3 days of being out in the street, the company gave in, right? And gave them air-supplied respirators. And that was a real eye-opener for me. It's not the first time I had seen organizing efforts around an issue yield positive results, but this was quite striking because the situation went from terrible exposure circumstances to a very nasty, potentially lethal hazard to respiratory protection in a matter of 3 days because workers had organized to make it happen. That was a big lesson for me, and I'd been reading about such things, had seen some evidence that such things could happen, but this was a clear demonstration to me of the power that facts have, not when they stand alone, because knowledge clearly isn't enough, and this is something that Dr. Selikoff, I think, taught all of us who work with him, that the facts, the data, the knowledge isn't enough. Somehow this has to be used by people who organize in their own interest, who take those facts and do something with it. And lo and behold, it really did change conditions in that shop. And I think that Dr. Selikoff had an unusual